Did you know that your body might be trying to warn you about heart failure, but most people miss these critical signals until it's too late? Every day, thousands of Americans over 60 discover they have heart failure only after severe damage has already occurred. But what if you could spot these warning signs just by looking in the mirror? In this video, I'll reveal 6 grooming signs that doctors immediately recognize as warnings of heart failure. Signs that you can spot today that could literally save your life. Let me tell you about Thomas, a 67-year-old retired teacher from Ohio. For months, he'd noticed unusual changes in his appearance. His nails looked different, his skin had a strange color, but he dismissed these as just normal aging. "That's just what happens when you get older," he'd tell his daughter whenever she expressed concern. Then one day, during a routine haircut, his barber noticed something alarming and urged him to see a doctor immediately. When Thomas finally visited his cardiologist, the doctor took one look at him and ordered immediate tests. The diagnosis: severe heart failure. "These signs have been visible for months," his doctor explained. "Without intervention, you likely had less than a year left. Today, thanks to recognizing these signs and getting proper treatment, Thomas is thriving. And in the next few minutes, I'll share exactly what his doctor saw, before it's too late for you. Let's get started with the first sign doctors immediately recognize. Sign 1. Unusual nail changes. Have you looked closely at your fingernails lately? Have you noticed any changes in their shape, texture, or color? These seemingly minor changes might be your body's desperate attempt to warn you about your failing heart. Cardiologists at the American Heart Association report that nail changes are one of the earliest visible signs of poor circulation caused by a failing heart. When your heart isn't pumping efficiently, oxygen-rich blood doesn't reach your extremities properly, and your nails are often the first place to show it. Dr. Jennifer Haith, a leading heart failure specialist at Columbia University Medical Center, explains, the nails can act as a window to your cardiovascular health. Changes here often precede more obvious symptoms by months or even years. Take the case of Doris, a 71-year-old from Nebraska who noticed her nails becoming more brittle and starting to curve downward like tiny spoons. She assumed it was just another sign of aging until her daughter, a nurse, recognized these changes as potential clubbing, a classic sign of heart and lung problems. When Doris finally saw her doctor, tests revealed her heart was functioning at less than 40% capacity. "If you hadn't come in when you did," her doctor told her, "we might have been having a very different conversation in just a few months." Here's what you need to do immediately. Examine your nails today. Are they developing a bluish tinge? This could indicate poor oxygen circulation. Have they started curving downward at the tips, creating a rounded appearance like tiny spoons? This clubbing is a serious warning sign. Have they become unusually brittle or developed ridges? These could all be your body's desperate attempts to alert you to heart problems. If you notice any of these changes, don't wait until your next scheduled appointment. Call your doctor today and specifically mention these nail changes. Time is critical when it comes to heart failure, and catching it early can mean the difference between a simple medication adjustment and major heart surgery. Is waiting another day worth the risk? Sign 2. Unexplained hair loss or texture changes. The way your hair looks and feels can reveal dangerous heart problems long before chest pain or shortness of breath ever begins. Are you noticing more hair in your brush? Has your hair suddenly become dry, brittle, or changed texture? Your heart might be sending you urgent warnings. Research published in the Journal of Cardiovascular Medicine shows that reduced blood flow from a failing heart often affects the hair follicles first, causing noticeable changes months before more serious symptoms appear. Dr. Richard Snyder, Director of Preventive Cardiology at Jefferson University Hospital, states, Hair follicles are extremely sensitive to decreased blood flow. When the heart struggles to pump efficiently, nutrient delivery to the follicles diminishes, often resulting in visible changes to hair quality, texture, and retention. Consider what happened to Lawrence, a 73-year-old retired accountant from Minnesota. He'd always had a full head of hair, but over just 3 months, he noticed it thinning rapidly and becoming unusually dry and brittle. His wife insisted it was just normal aging, but when he mentioned it during a checkup, his doctor immediately ordered cardiac tests. The results? Lawrence's heart was only functioning at 35% capacity. "Your hair was trying to tell you something," his cardiologist explained. "If we hadn't caught this now, you would have been in the emergency room within months." Here's what you must do today. Run your fingers through your hair right now. Is it coming out more easily than before? Has the texture changed suddenly from smooth to brittle? Is there an unusual pattern of loss emerging? These aren't just cosmetic concerns. They could be life-saving warnings. If you notice these changes, take a clear photo of your hair, especially areas of thinning, and make an appointment with your doctor this week. Specifically mention the sudden changes and ask about possible connections to heart health. Don't wait for more serious symptoms to appear. By then, significant damage may have already occurred. Remember, catching heart failure early means simpler treatment and better outcomes. Why risk waiting even one more day? Sign 3. Swelling in specific facial areas. Has your face started to look puffy or swollen, especially in the morning? Do your cheeks or the area around your eyes look different in the mirror? This could be one of the most overlooked signs of heart failure that doctors immediately recognize. Heart specialists at the Mayo Clinic warn that fluid retention from a weakening heart often shows up first in the face, particularly around the eyes and jaw. This happens because when your heart can't pump efficiently, fluid backs up throughout your body, and gravity causes it to collect in the lowest places while you're lying down, including your face when you sleep. Dr. Marielle Jessup, Chief Science and Medical Officer of the American Heart Association, explains, morning facial puffiness, especially around the eyes, can be one of the earliest visible signs of fluid retention related to heart failure. Take the case of Harriet, a 69-year-old retired librarian from Wisconsin. For months, she noticed her face looking increasingly puffy in the morning. She tried changing her pillows, cutting salt, and even expensive creams, assuming it was just part of aging. At her daughter's wedding, a relative who hadn't seen her in years commented on how her face had changed. When Harriet eventually mentioned this to her doctor, tests revealed moderate heart failure that had been developing silently for months. "Those changes in your face weren't aging," her doctor told her. "That was your body's way of warning you that your heart wasn't keeping up. Here's what you need to do. Tomorrow morning, immediately after waking up, look closely at your face in the mirror. Pay special attention to the area around your eyes, your cheeks, and your jawline. Is there noticeable puffiness that wasn't there years ago? Does it improve throughout the day as you're upright? Take a photo first thing in the morning and another in the evening to compare. If you notice persistent morning facial swelling, especially if it improves when you're upright during the day, call your doctor this week. Specifically mention the pattern of swelling and ask about heart-related fluid retention. Don't wait for more dramatic symptoms. Early intervention can prevent irreversible heart damage. Is your appearance telling you something your body desperately needs you to hear? Sign 4. Visible skin color changes. The sign everyone can see. The color of your skin might be broadcasting your heart health to everyone around you. Even strangers can often spot this warning sign before you notice it yourself. This isn't about normal aging. It's about specific color changes that signal dangerous heart failure. Harvard Medical School researchers have documented that specific skin color changes are so strongly linked to heart failure that experienced doctors can often diagnose patients just by looking at them. When your heart isn't pumping efficiently, oxygen-rich blood doesn't reach your skin properly, causing subtle but distinct color changes. Dr. Andrew Waxler, cardiologist and member of the American College of Cardiology, states, "The skin is essentially a canvas that reflects what's happening with circulation. Certain color changes, particularly around the lips, nail beds, and earlobes, can be immediate red flags for heart failure. Consider Bradley, a 75-year-old retired construction worker from Arizona. He had always been active and healthy, but his barber of 20 years noticed something concerning during a routine haircut. A bluish tinge to Bradley's lips and a grayish cast to his complexion that hadn't been there before. "You need to see a doctor," his barber insisted. "Something's not right with your color." When Bradley finally went in for a checkup, his doctor immediately ordered cardiac tests. The diagnosis? Congestive heart failure that required immediate intervention. "Your barber may have saved your life," his cardiologist told him. "These color changes have probably been developing for months. Here's what you need to do right now. Look at your skin in natural lighting, particularly your lips, the inside of your lower eyelids, and your fingertips. Do your lips have a bluish or purplish tinge rather than healthy pink? Does your skin have a grayish cast? Is there a yellowish tinge to the whites of your eyes, or a pale appearance to areas that should be pink, like your gums or the inside of your lower eyelids? If you notice any of these color changes, take a clear photo in natural lighting and see your doctor within 24 hours. These aren't cosmetic concerns. They're potentially urgent warnings of poor circulation from a failing heart. Tell your doctor specifically about the color changes you've observed. Remember, the earlier heart failure is caught, the more treatment options you have. Don't wait for chest pain or shortness of breath. By then, significant damage has often already occurred. Sign 5. Changes in ear appearance. When was the last time you really looked at your ears in the mirror? Most people never check this area, yet it could be showing one of the most scientifically validated signs of heart problems that doctors immediately recognize. According to research in the American Journal of Cardiology, specific changes to earlobe appearance strongly correlate with coronary artery disease and heart failure. In fact, this connection is so well established in medical literature that it has its own name, Frank's sign. Dr. Elizabeth Jackson, professor of cardiovascular medicine at the University of Alabama, explains, "A diagonal crease in the earlobe has been repeatedly shown in studies to have a significant association with coronary artery disease. It's something cardiologists always notice, but patients rarely do." Take Gregory, a 72-year-old retired teacher from Pennsylvania who went for a routine checkup. During the examination, his doctor noticed diagonal creases across Gregory's earlobes. Though Gregory had no symptoms and felt fine, his doctor immediately ordered cardiac tests based on this single observation. The results showed severe blockages in 3 major coronary arteries, a condition known as triple vessel disease that often leads to heart failure. "I had no idea my ears were trying to warn me," Gregory said later. "I felt perfectly normal, but according to my cardiologist, I was at high risk for a major heart attack within months." Here's what you must do today. Find a well-lit mirror and really examine your earlobes. Do you see a diagonal crease running across either or both of them? This isn't a normal aging change. It's potentially a critical warning sign. Also check for unusual thickening of the earlobe tissue or changes in earlobe shape. If you notice these ear changes, don't wait. Take clear, close-up photos of your ears and make an appointment with your doctor this week. Specifically mention the earlobe creases and ask about their connection to heart health. These simple observations could literally save your life by catching heart disease before it progresses to advanced heart failure. Isn't a quick look in the mirror worth that peace of mind? Sign 6. Unexpected dental and oral changes. Your mouth could be showing the first signs of heart failure long before you feel chest pain or shortness of breath. These changes often go unnoticed or are dismissed as normal aging, but doctors and dentists immediately recognize them as potential warning signs of heart problems. Dental researchers at the University of Pennsylvania have established clear links between certain oral changes and cardiovascular disease. When your heart isn't pumping efficiently, it affects blood flow to your gums and oral tissues, causing visible changes that research now shows often precede other heart failure symptoms. Dr. Lisa Stevens, director of the Cardiovascular Oral Health Connection Research Program, states, "The mouth can serve as an early warning system for heart problems. Changes in gum appearance, unexplained tooth mobility, or persistent bad breath that doesn't respond to normal oral hygiene can all be red flags for poor circulation related to heart failure." Consider Vincent, a 70-year-old retired postal worker from Florida who noticed his gums bleeding more easily and had developed persistent bad breath despite diligent brushing and flossing. His teeth had also become more sensitive without explanation. Vincent assumed these were just normal aging changes until his dentist became concerned during a routine checkup and suggested he see his physician. When Vincent finally saw his doctor and mentioned these oral symptoms, tests revealed early-stage heart failure. "Your mouth was telling us your heart was struggling," his cardiologist explained. "Most people wouldn't connect these symptoms, but they're actually closely linked. Here's what you need to do immediately. Examine your mouth carefully today. Are your gums receding more than before, or appearing purplish rather than healthy pink? Do your teeth feel looser, or have you developed unexplained sensitivity? Has persistent bad breath appeared despite good oral hygiene? Look at your tongue. Has it developed a whitish coating or unusual texture? If you notice any of these changes, make an appointment with both your dentist and your doctor this week. Tell them specifically about the oral changes you've observed and ask about possible connections to heart health. Many patients report that their dental problems were the earliest sign of heart failure, one that could have led to earlier diagnosis if recognized properly. Don't dismiss these changes as just getting older. They could be your body's desperate attempt to warn you about your heart. Now that you know these 6 critical signs, you have the power to potentially save your own life by catching heart failure before it progresses to dangerous levels. From nail changes and hair texture to facial swelling, skin color, earlobe creases and oral health, your body has numerous ways of alerting you to heart problems long before more obvious symptoms appear. The key is paying attention to these subtle changes and taking immediate action. Heart failure doesn't have to be a death sentence. Caught early, it can often be effectively managed with medications, lifestyle changes, and proper medical care. But you must recognize these warning signs and act quickly. If you've noticed any of these 6 signs while watching this video, don't delay. Contact your doctor right away and specifically mention these observations. Your proactive attention to these subtle but critical changes could mean the difference between a simple treatment plan and a life-threatening emergency. Don't wait until it's too late. Check for these signs today. If you found this information valuable, please hit the like button right now and subscribe to our channel for more potentially life-saving health information. Comment below which sign surprised you the most, or if you've noticed any of these changes in yourself or a loved one. Share this video with friends and family over 60. What you've learned today could literally save someone's life.